Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam-Oriented Clinical Neurology. We are continuing with a series of lectures of Prime Neurology. There are going to be about 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on Prime Neurology Part 24, Epilepsy Part 4, Status Epilepticus. So in this episode we are going to discuss Status Epilepticus. Status Epilepticus. Status Epilepticus refers to continuous seizures or repetitive, discrete seizures with impaired consciousness in the interictal period. A more practical definition is any situation requiring the acute use of anticonvulsants. In generalized convulsive status epilepticus, this is typically when seizures last more than 5 minutes. The clinical features has numerous subtypes. Generalized chronic status epilepticus. Example, persistent generalized electrographic seizures, coma and tonic-clonic movements. And non-convulsive status epilepticus. Example, persistent absence seizures or focal seizures with confusion or partially impaired consciousness and minimal motor abnormalities. Generalized convulsive status epilepticus is obvious when overt convulsions are present. But after 30 to 45 minutes of uninterrupted seizures, the signs may become increasingly subtle, mild clonic movements of the fingers, fine rapid movements of the eyes, or paroxysmal episodes of tachycardia, pupillary dilatation, and hypertension. Electroencephalogram may be the only method of diagnosis with these subtle signs. Therefore, if a patient remains comatose after seizure, EEG should be performed to exclude ongoing status epilepticus. Generalized convulsive status epilepticus is life-threatening when accompanied by cardiorespiratory dysfunction, hyperthermia, and metabolic derangements such as acidosis from prolonged muscle activity. Irreversible neuronal injury may occur from persistent seizures even when a patient is paralyzed from a neuromuscular blockade. Etiology. The principal causes of generalized convulsive status epilepticus are anti-epileptic drug withdrawal or non-compliance, metabolic disturbances, drug toxicity, CNS infections, CNS tumors, refractory epilepsy, and head trauma. Treatment of status epilepticus. GCSE is a medical emergency and must be treated immediately. First, attend to any acute cardiorespiratory problems or hyperthermia. Perform a brief medical and neurologic examination, establish venous access, and send labs to screen for metabolic abnormalities, including anticonvulsant levels if patient has a history of epilepsy. Anticonvulsant therapy should then begin without delay. In parallel, it is essential to determine the cause of the seizures to prevent recurrence and treat any underlying abnormalities. The treatment of non-convulsive status epilepticus is somewhat less urgent since the ongoing seizures are not accompanied by the severe metabolic disturbances of GCSE. However, evidence suggests cellular injury in the region of seizure focus, so the condition should be treated as promptly as possible using the general approach for generalized convulsive status epilepticus. The mortality rate is 20% in GCSE and the incidence of permanent neurological sequelae is 10 to 50%. So, approach to the treatment of status epilepticus in adults. The initial assessment, immediate suppression of convulsions, initiations or reloading with anticonvulsants, general anesthetic doses of medication for persistent status epilepticus, further treatment if convulsions or electrographic seizures persist after several hours. So let's go step by step. The initial assessment. Ensure adequate ventilation, oxygenation and blood pressure. Intubate if necessary based on low oxygen saturation and labored breathing. Insert intravenous line. Administer glucose and thiamine in appropriate circumstances. Send toxic screen. Assess quickly for cranial and cervical injury if onset of seizures is unwitnessed. Immediate suppression of convulsions. Lorazepam or diazepam 2 to 4 milligrams per minute IV to a total dose of 10 to 15 milligrams with blood pressure monitoring when higher rates or doses are required. Initiation or reloading with anticonvulsants. Phenytoin 15 to 20 milligrams per kg IV at 25 to 50 milligrams per minute in normal saline or fosphenytoin at 50 to 75 milligrams per minute. General anesthetic doses of medication for persistent status epilepticus. Midazolam 0.2 milligram per kg loading dose followed by infusion at 0.1 to 0.4 milligram per kg per hour or propofol 2 milligrams per kg per hour. Further treatment if convulsions or electrographic seizures persist after several hours. May add valproate or phenobarbital 10 milligrams per minute to a total dose of 20 milligrams per kg as additional anticonvulsants intravenously, or carbamazepine or levetiracetam by nasogastric tube if there is gastric and bowel activity. Consider neuromuscular paralysis with EEG monitoring if convulsions persist. Pentobarbital 10 milligrams per kg per hour. Inhalational anesthetics like isoflurane. So these are the wonderful concepts of status epilepticus. The other concepts of clinical neurology, I put it in a book called Exam Oriented Clinical Neurology, written by me, Dr.Sreenivas, published by White Army. This book will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other book I have written is Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. This book contains all the essential elements of theoretical neurology in a question and answer format. So this book will be very useful for students appearing for orals or Viva OC. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online from Amazon. I hope you have enjoyed listening to these wonderful concepts of status epilepticus. As I said earlier in the beginning of my lecture, there are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Just now we are done with another episode of Prime Neurology. So if you have enjoyed listening to these wonderful concepts, please like, share and subscribe to my YouTube channel, Dr. Sreenivas Medical Concept, which is India's leading neurology educational YouTube channel, and my Facebook page, Dr. Sreenivas Concepts. Thank you for listening. Bye.